Merhaba, bugün berat sizinle akmatan mutluluk duyuyorum. That's the best I can do. It's a pleasure to be with you here today, and I will speak slowly so that the translation can happen easily. For those who don't know me, I'm a child and adolescent psychiatrist, and I was appointed to the Senate of Canada in 2018. And I'll say a little bit about the Canadian system in a couple of minutes. But I'm the only psychiatrist to have ever been in the Senate of Canada since the beginning of Canada. And sometimes I'm not sure if I'm the psychiatrist in the Senate or the psychiatrist for the Senate. I've learned very much since I've been in Parliament. And one of the most important lessons that I have learned is that it doesn't matter how wonderful your research is. It doesn't matter how good your ideas for delivering service are. It doesn't matter how good an educator you are, if those things don't get into the systems of care. And there is a huge gap between practitioners and researchers and what actually happens on the ground. And that gap is bridged by two groups of people. One group are the bureaucrats, whose job is to run the machinery of government, and who I think do it well sometimes, do it poorly often, and do it slowly always. The other are the parliamentarians in a democratic system. Those are your elected and unelected officials whose job it is to make the law. And policy is used to inform both the bureaucracy and the making of legislation. So it's really, really important that practitioners and researchers understand how policy is made. And it is really, really important for practitioners and researchers to understand not only how to influence that policy, but understand that it is imperative that you influence that policy. Let me give you one little example of the problem. About a year and a half ago, our House of Commons Healthcare Committee was doing a study on child and maternal mental health. Okay? Child and maternal mental health. And in our committee studies, witnesses come, give their opinions, give their data, and that testimony and those committee studies are fundamental for setting the policy agenda. If it's not in the policy, it's not going to happen. Out of about 30-some or 40-some witnesses before that committee, there was one child psychiatrist on a study on child and maternal mental health. One. So do you know how much input the child and adolescent psychiatrists in Canada got to have on the development of policy that influences everything that they do? Zero. If you are not at the table where policy is made, it will be made anyway. If you are not at the table where policy is made, you get no voice in how that policy is going to come out. It may not come out the way you want it, even if you're there, but I can guarantee if you're not there, it will not come out anywhere near what you think is important. Because other people are. Other people are. And I'll give you another little example. I'm a psychiatrist, I'm in the Senate. I do have influence on policy. The whole time that I have been in the Senate, since 2018, the number of psychiatric organizations that have come to see me to talk about what they want to happen for mental health in Canada are zero. Zero. The number of times that the dairy industry lobby has come to see me is about 67. How can we help make good policy if you're not involved? We can't. We can't. Now, I'm going to share with you Stan Kutcher's 4 criteria for effectiveness in changing human behavior. The one that has the greatest impact on changing human behavior in a democratic country is legislation. You have to do this. Okay, it's the law. Seatbelts, for example. The second most effective way of changing human behavior is regulations. Food safety, for example. The third most effective way of changing human behavior is incentivization. If you do this, we will pay you for it. And the last and least effective way of changing human behavior is education. Now, we need to have education. But let me be clear. If you don't have legislation, if you don't have regulations, and if you don't have incentivization, you don't change human behavior. And the place where the legislation and the regulation and the incentivization, also called funding, sits is in your leadership. So how do I move this slide projector here? Oh, good. So I'm going to talk about those very, very important things for moving the gap between practice, clinical practice and research policy into effectiveness on the ground. I have 6 things here. We're going to talk a little bit about Canada's parliamentary system so that those who are not familiar with it can understand it. But the same fits for any democracy. I'm going to talk a little bit about how our federal system impacts on healthcare. I will talk about some of the recent federal initiatives for mental health and how they came about. I'll talk about the importance of political advocacy, and then I will talk about the greatest threat to global mental health that we have ever had in the history of humankind, and how to deal with it. So first, about Canada's parliamentary system. When we talk about democracies, there are three really important things to remember. One is elections. All democracies have elections, but not every country that has an election is a democracy. So this fantasy that if you have an election, you're a democracy is completely wrong, delusional almost. Elections are necessary for a democracy, but they are not sufficient for democracy. They are not, as we say, the sine qua non, the defining feature of a democracy. All democracies have a non-violent transition of power. As soon as you see violence in the transition of power, you know you are either not living in a democracy or your democracy is under threat. And those of you who remember Mr. Trump's refusal to give up power 4 years ago and a bit, that was a very strong signal that that democracy was under threat. Never in the history of the United States, if there had been a mob running through the Capitol, would the authorities not have sequestered and removed and safeguarded the president? You know it was a coup attempt because no one tried to protect the president. He didn't need protection. Really important thing. And then we have institutional guardrails. So democracies are set up to make it difficult for one person or one group to take over power. And those are institutional guardrails. And those include the way that parliaments are established, the way the judiciary is established, the separation of church and state, the separation of institutions of higher learning from the dictates of government. If this is sounding familiar, it should be. All these things are separated from each other, and all these things are set up in a system of checks and balances of each other to make it difficult for one group or one person to take over the machinery of government. Institutional guardrails are essential for any functional democracy. Now, Canada has a Westminster-style democracy. That means our lower house is elected, but our upper house, where I sit, is appointed. The lower house runs on a political party framework. The upper house, since 2016, has been no political parties, which is an added safeguard for democracy. Because what we've seen, for example, in the United States, is one political party taking over both the House and the Senate, so that they are now not effective in balancing each other. Now, we have a national system, but it is a federated system. So that means although Canada is a nation, it is made up of separate components, provinces and territories. In that federation, there are shared responsibilities and unique responsibilities. So for example, one example of a unique responsibilities is the federal government has sole authority and sole discretion for the defense of Canada. We have Dr. Rakesh Jetley with us, who served with distinction in Canada's armed forces. There he is. The armed forces of Canada are under the sole authority of the federal government. there are shared authorities, and there are sole authorities under the provincial. So the sole authority, for example, under provincial is education. There are no national standards for education in Canada. There is no national curriculum in Canada. Every province does its own work, which makes it very hard to do things nationally in education. Now, the federal government has taken over some of that work in education surreptitiously by funding universities through a program called the Canada Research Chairs Program, by funding research or agencies like the Tri-Councils, who then universities get the grants from. But the federal government has no authority over education. So the reason that it funds universities is that the universities are independent entities. But the federal government doesn't fund primary or secondary education because that is completely under the control of the provinces. So you see how it goes? Health is both a shared and a unique responsibility. That means the provinces are primarily responsible for health, but the federal government has some specific impact on health in provinces, and the federal government is responsible for the health of the members of the Canadian Armed Forces, for the health of our Indigenous population, and for the health of the Royal Canadian Mounted Police, which is a federal police force. So if it sounds confusing, it's because it is. So here are some of the shared responsibilities related to health. Public health is both a responsibility of each province and territory, but also of the federal government. And when it works well, they all work together. But when it doesn't work well, it's a mess. And we saw that during COVID. When one province would make one set of recommendations, another province would make another set of recommendations, and the federal government would make another set of recommendations. No wonder people were confused. Data collection on health. Again, a federal responsibility, but they can only do what the provinces allow them to do. Huge conflicts. There are organizations like the Canadian Institute of Health Information that collects data across the country, but they cannot access provincial data sets unless the provinces give their permission. And sometimes when the provinces get annoyed at the federal government, they stop permission. And health human resources planning. Each province is responsible for its planning. How many child psychiatrists should be in this province? And most of them don't do that planning. So the federal government tries to do some of that planning, but it doesn't do it very well because it has to have the provinces participating, and they don't participate well. So we have a real challenge here. Healthcare delivery, as I said, in the federal government, there are some unique things, like the Canadian Armed Forces, and regulation of medicine. Health Canada, like the Food and Drug Administration in the United States, regulates all medications and all medical products. All right? So all of that is regulated federally, not provincially. We now have a unique addition to that, which is with PharmaCare, which is a national payment system for medicines coming into place. The federal government makes agreements with each of the provinces to bring the same program. So the program is the same, but each province has to make an agreement. And the federal government gives money every year in what's called federal transfer payments to provinces, a lot of money, billions and billions of dollars. And the provinces and the federal government always fight over the money, and the federal government does not have the authority to tell the provinces what to do with the money. The federal government has tried a number of times, and the provinces have not complied. So you can see that we have a bit of a dog's breakfast. So if you're trying to influence what happens in mental health care, you, as a practitioner, or the organizations that represent you, have to be active at both the provincial level and at the federal level, because that's where you are able to influence where the policy occurs. And ideally, the national organizations should be active at the federal level and each provincial organization at each provincial level, and they should be talking to each other. So I'll just share some of these things that have recently happened. We have, a few years ago, a new minister appointed in Canada called the Minister of Mental Health and Addictions. And the person that was appointed to that position for the first time was a friend of mine, a physician, primary care doctor, Carolyn Bennett, who also was the person who first was appointed to head the Public Health Agency of Canada. She built the Public Health Agency of Canada, a seasoned politician, superb person. And it was good that the Prime Minister created that ministry, so that gave a focus for a place that we could start federally to improve mental health care in general and mental health care for children and adolescents in particular. I was very fortunate as a senator because I knew her very, very well. I had helped her when she set up the Public Health Agency of Canada. And we knew each other extremely well. We're good friends. So it gave me a tremendous opportunity to be able to influence what Canada would do to improve mental health care and to improve child and adolescent mental health care. Plus, in the Senate were 6 physicians. First time ever, that many doctors in the Senate. Some nurses, some social workers. And we got together to create a health care caucus, so we could work together to try to influence. Having that point of contact was really, really important. And having a champion within the ministers for mental health gave a window of opportunity that Canada had never had before. But one of the reasons that this new cabinet position was set up was because the Prime Minister had been lobbied to do so. It didn't come out of thin air. One of the outcomes of that was the development of a mental health literacy repository. And Professor Way is here. She worked very closely with the Public Health Agency of Canada, spearheaded by the minister. The minister decided, Dr. Way met with the minister, and the minister decided that she wanted to make Canada a mental health literate country. That was Dr. Way's idea. And the first step in that was to create a repository of what are effective and cost-effective mental health literacy interventions. Dr. Way is working on that. The amount of effort that it took to get that to happen is unbelievable. But it never would have happened without the effort. Data collection. Canada has an organization called Statistics Canada, StatsCan for short, which is fantastic. But the way that they do their data collection work is under direction from different ministries. And it had done some work on data collection for youth mental health, but it was not at the kind of depth and the persistence, the sustainability that we needed to have to be able to understand what was happening in youth mental health across the country, and then to be able to see what interventions impacts there were. There was an organization called the Mental Health Research Canada, and Professor Greenshaw is on the board of that organization. They came to the ministry with ideas for establishing national youth mental health focused research. It was their hard work and a little bit of pressure from outside, and they were now setting up to be able to do that. But none of that would have happened if we didn't have a Minister of Mental Health and Addictions and pressure to move that ideas into policy. And because it is funded by the government, that's the incentivization part. Targeted investments. One of the first pieces of legislation that I amended, it's a tremendous power to be able to sit there and get a law and say, I don't like the way that this is written, they should be written this way, convince your colleagues that you're right, and then see it become law. It's a pretty impressive, amazing thing. And I got to tell you, in Canada, when we vote on some legislation, we have to stand up and they read your name out. And every time, for every piece of legislation that I vote on, when I stand up, it gives me goosebumps, because that's where I stand on this. Whether we win or we lose the vote, doesn't matter. You're standing there and it's your vote. In that legislation, it was legislation around prisons, about what was called structured intervention units, also known as isolation, prison isolation. And we were able to amend that to bring mental health assessment of every single prisoner in the federal prison system, and then use that mental health assessment to guide the rehabilitation program of that person. That's an incredible amount of power through the legislation. I was able to do that because with colleagues who are experts in prisons, we got together and said, how can we improve this legislation? What do we need to do to make it a better piece of legislation? And that allowed us to put mental health into that legislation. It didn't help the mental health of young people who were on the street in Calgary, but it sure helped the mental health of people who were incarcerated in prisons. And those of you who know the statistics know that 60 to 70% of incarcerated persons have a mental disorder or a substantive mental health problem. So you can make an impact even though it's not directly in mental health legislation. When COVID hit us, the federal government struggled with what to do in every aspect, and overall, if you look how we did fairly well. One of the things that it did, and that I worked on very hard, was creating better data, and the Mental Health Research Canada opportunity arose from the Deputy Minister realizing that we really needed much better data. And I was able to partner with academics from University of Alberta to pressure the government to be able to commit to better data. The government also created a digital health response called the Canada Wellness Portal. And that digital health response was created ad hoc, was created poorly. It followed none of the criteria that we heard in the keynote plenary about how these products or procedures or components should be created. And as a result, it did not do what it should have done. I was able to convene, because of my role, a group of experts to evaluate that and give the government suggestions on how to improve it or change it. It was an incredible amount of work. And the academics that worked on it, I have to thank them. They did a fantastic job. The challenge that happened is that it got back into the bureaucracy, and when COVID-19 finished, although the direction was clear, there wasn't a lot of follow-through, although some of it went into informing policy for digital mental health directions for Canada. And the last thing I'm going to talk about is suicide prevention. Suicide prevention, a very, very important topic for every single country. Canada had a suicide prevention framework, which, in my opinion, was complete nonsense. It had been developed by interest groups. It followed no substantive evidence for what actually works in suicide prevention. And it just kept pouring money into things that we know don't work. And of course, the results, as expected, were nothing. I spent 4 years, or 3.5 years, trying to get the Public Health Agency to change its suicide prevention framework. To no avail. I finally created a motion in the Senate and had the Senate vote to allow the Senate to do a study of Canada's suicide prevention framework, and as a result of that study, create a report that would direct the government on how to improve the suicide prevention framework. The Senate voted to do that. The committee that I sat on at that time did the study. We brought Canada's top experts, plus a number of international experts on prevention in. The report was pithy, to the point, basically said, Canada's suicide prevention framework is not useful, it's not based on best available evidence, and this is how it should be changed. The minister welcomed it, directed her bureaucracy to change the suicide prevention framework. That was 4 years ago, 3.5 years ago. We're still waiting for it to come out. But none of that would have ever happened without the impact on the policy. We just got it in a different way. So what I'm trying to do here is to show you a few, these are not all the things, but to just show you, give you a few examples of how important it is to have a champion in the parliamentary system if you want to improve mental health outcomes, if you want to improve the funding for research, if you want to improve the funding for child and youth mental health, if you want to change the way that the human resources are developed and supported. All those things. If you don't have a champion in the parliamentary system, the chances of you getting them are very small to zero. Oh, it's not moving ahead here. Could you move the slide for me one, please? This is not working. Hello? Could you move the slide one? Time to wake up. Yeah, it's not working. Oh. No, it went backwards. Could you put it back? But it wasn't, no, keep back. Back. One more. Okay, now it's working. Thank you. So these are the take-homes. Number one, that all important health policy decisions, including funding, are political decisions. When I started to talk about this with my colleagues, they said, ooh, we hate politics, it's too dirty. Well, I'll tell you something. If you don't have mud on your hands, you're not in the playground. They are all political decisions. Every single one is a political decision. And who's making them? The politicians. And if the politicians don't know what they're doing, you're in trouble. And if you're not at the table, you're not at the table. If you're not influencing, point number two, if you're not influencing those decisions will happen anyway. They're going to do something. But they may end up not only not doing the right thing, they may end up doing the wrong thing. Because remember, the drive to do something is often in response to a lot of pressure from the public. But how to do the right thing in response to that pressure is not provided by the public itself. It's provided by the advice that the politicians are given. And if child and adolescent psychiatrists and psychologists are not sitting at the table and giving that advice, the decision will very often not be the one in the best interest of children and adolescents or their families. In the Canadian system, and in my years of working all over the world with the WHO and PAHO, they're very similar in all democratic countries. There are a few key influence points. So one is the champion. And if you want to influence policy and legislation, you have to find your champion who is a politician. Or in my case, I'm not a politician, I'm a parliamentarian. But somebody who was sitting in the political arena who will champion you and your cause. You need to have that. You have to find those people. You have to nurture the relationship with those people. You have to visit those people and talk to those people. Because if you're not doing that, it will not happen. You have to find the champion. Legislation. Every piece of legislation goes through a long public consultation process. Every piece. Sometimes the legislation is posted electronically and the public gives their input. Sometimes, always the legislation goes to committee and experts and the public testify. Always the legislation is voted on by the members of parliament, by the politicians, by the parliamentarians, and that is another point of influence. At every single point of influence, if you're not active, your voice does not get heard, and the legislation can come out in a way that isn't helpful. Or worse, it can come out harmful. Every parliament does studies on topics that are important for policy, some of which may end up in legislation or regulations or in funding. Really important. And those committees call expert witnesses. I gave you the example of the Child and Youth Mental Health Committee having one child psychiatrist testify. Knowing where those committees are and knowing how to testify is essential. And that goes in Canada for provinces as well as federal, if you want to have input. And then the third thing is lobby activities. Before I went to Parliament, I thought the word lobby was a dirty word. But Parliament works on lobbying. That's how it works. I shared with you, I've had no psychiatry organizations come to visit me officially. The dairy farmers are there all the time. The chicken farmers are there all the time. The steel industry is there all the time. The auto industry is there all the time. Why is it that they are favorably received? Why do they have good legislation supporting them? Because they're there all the time. Organizations are stronger than individuals. You always go together. If you go alone, that's a problem. That doesn't mean you can't go alone. It means that if you go together as a large organization, you're more likely to be listened to. Now, if you have a parliamentarian who's your friend, that's fine. So when Professor Greenshaw wanted to talk about digital mental health, he just came over, talked about it. Okay? And I listened to him because I trust him. But if the Canadian Psychiatric Association isn't coming to talk to me, they have a problem. In fact, during COVID, I had to reach out to them and got them to work together with the professors of psychiatry to come up with recommendations for the federal government of what to do because they weren't doing anything. Okay? It can't be that way. It has to be the other way. You have to be pushing. And really, don't give up. Some days I feel like I'm Sisyphus from Greek mythology. You roll the stone uphill almost to the top of the mountain all day, and then at night the stone rolls down, and you start rolling it back up again the whole next day. And every day you go to work and you roll that stone and roll that stone and roll that stone. And that's in every single thing that you do. Don't give up. Because if you give up, then who's going to do it? All right. So I've given you some pointers. I've given you some things to think about how you would adapt them to your own situation. And now I'm going to raise a different issue. The world has never had a single point of threat for global mental health, ever in the history of humankind. It does now, and this is it. This is Robert F. Kennedy Jr., and he is single-handedly the largest threat to the mental health of everybody on this planet. He is known to be a prominent anti-vaxxer. He has just, when I responded to this, gone on national television to say that the COVID vaccine killed more people than the people who didn't receive it. Complete and utter lies. One of the huge and undiscussed for children crises of COVID-19 was the death of their parents. He has argued that vaccines cause autism. You're a child and adolescent psychiatrist. He will have a report, I think, in 4 weeks that will prove that vaccines cause autism. You know that they don't. But he will have a report created by his sycophants that will say it does. But how many child and adolescent psychiatry or pediatric organizations are speaking out against this now? Not just in the United States, but all over the world. Where are they? Are they happening in your country? Is they happening in Belgium? Because this is coming to Belgium. Are they happening in Turkey? Because this is coming to Turkey. Happening in the Netherlands? Because this is coming to the Netherlands. I've actually, just with my colleague Senator Moody, created a national approach to vaccines in Canada to deal with vaccine disinformation. We'll be hopefully rolling it out in the next 2 or 3 weeks for children. Kennedy goes down and says, oh, the child that died of measles was of malnutrition. No, malnutrition doesn't cause measles. He is one of the world's largest and most prolific spreader and creator of health disinformation. I have a study before the Senate now looking at Russian disinformation's impact on Canadian civil society. I've been in the health disinformation area for a decade now. The single largest global spreader of health disinformation 6 years ago was Mr. Trump. Now it's Mr. Kennedy. Not only does he spread the disinformation, he creates it. He's what we call in English a grifter, somebody who profits over the harm he causes to others. He has an organization called the Children's Health Defense. I would encourage you to go online to their website so you can actually see what impact the Children's Health Defense is going to have on mental health and mental health care for children. He's a well-known conspiracy theorist. Wi-Fi causes all sorts of health problems. Fluoride will kill you. No. He doesn't understand the basic pharmacologic principle of the dose is the poison. He thinks that AIDS does not exist, and if it does, it doesn't cause HIV. And the list goes on and on and on. And he is now the Secretary of Health and Human Services in the United States of America, which is still the strongest portfolio to impact the health, not only of Americans, but globally. For child and adolescent psychiatrists, you better be aware and you better start getting ready. He has had full frontal attacks on mental health. He has come out during his hearings, his confirmation hearings, school shooting is caused by SSRI medicines. Contrary to all the evidence that we have, he just goes out there and says it, and all these idiots that listen to him spread the word. He says that antidepressants are addictive and almost the most addictive compounds known to humankind. He says that heroin withdrawal, which he knows well about, having gone through it, I'm sure, a number of times, is worse than SSRI withdrawal, and therefore SSRI should never be prescribed. He says people should not use medicines to treat mental health conditions. That's very clear. He says that the Food and Drug Administration is corrupt, and therefore we don't need an oversight agency, and that, quote, natural healing is the best. Sure, you have schizophrenia. Don't take a medicine that we know works. Just get healed naturally. And there is no evidence needed for any kind of intervention, and it would be funny if it wasn't so terrifying. His major approach to treating mental health conditions are what are called wellness farms. Now, if you're interested in the wellness debacle, just Google the wellness debacle or something like that. You'll come up with all sorts of articles that show us what wellness is and what it is not. He is the Rottweiler that is attacking. He is the point of attack on mental health providers and on evidence-based mental health care. And he is driving it. And what he is going to do in the next 3 to 6 months are going to damage global mental health care and in the United States, and very much for children and young people. How much damage, we don't know yet. The vehicle that he is going to do this by is called the Make America Healthy Again Commission. Does that sound familiar to you? Make America Great Again, Make America Healthy Again? He just happens to be its chair. The commission will find what he believes in. The commission has already targeted, through various routes, health research. Who here knows what's happened to the National Institutes of Health Research? It's been gutted, including the infrastructure grants that go to universities to do the research that's necessary. All child oncology research has stopped. He has gutted the public health surveillance capacity of the Centers for Disease Control. The United States no longer has the ability to detect and respond to pandemics. Natural healing will be fine. He has taken on the insurance industry He wants the insurance industry to be beneficial, that is to support life changes, particularly diets, which he thinks was going to cure all illnesses. And he is attacking expert healthcare providers as being agents of the insurance industry, agents of the pharmaceutical industry, and agents of their own greed. So if you're a doctor or a psychologist, you are under attack. Childhood chronic diseases, according to the Make America Healthy Again Commission, are caused by the American diet. You may have some point there. Absorption of toxic material like fluoride, by medical treatments themselves, lifestyle, environmental factors, yeah, some of them, government policies, like not funding people who are poor. Well, what are they doing? They're taking away all that funding. Food production techniques, like GMOs. Electromagnetic radiation. And corporate influences, or cronyism, and you are part of the cronies. This is a direct quote from one of the things that the Commission is doing, and I quote, "To assess the prevalence and the threat posed by the prescription of selective serotonin reuptake inhibitors and antipsychotics, mood stabilizers, stimulants, and weight loss drugs." Now, if you're a child and adolescent psychiatrist, if you're a psychiatrist of any kind, and Mr. Kennedy decides that you cannot prescribe SSRIs, antipsychotics, mood stabilizers, or stimulants, just how helpful are you going to be to your patients? The threat is not the medicines. The threat is Mr. Kennedy. I'll translate that for you. No more genetically modified foods, which is a big part of our food supply and does not cause the problems. No food preservatives of any kind. No FDA approvals for medications. Get rid of the FDA. No fluoride in the drinking water. If you're a dentist, you're going to have a lot of business. No evidence needed for whatever intervention you choose. All sorts of conspiracy theories are welcomed. The chemtrails in the sky, which are actually water vapor, big welcome. No vaccines, no medical expertise needed, and no psychotropic medicines. That's what the guy is doing. I'm raising this with you because I have decided I'm going to start raising this with psychiatrists all over the world, and you're the first group. I just published a paper in the Journal of Public Health with a professor of public health from Switzerland, because I was speaking at a global health security meeting in Taiwan the day that Trump became elected as president. And on that day, in my speech to the Global Security Forum, I put away all my notes, I put away all my slides, and I talked what is the damage that Trump is going to cause to global health. And she was in the audience, she came up and we wrote a paper, it was just published last week. I don't want to go into the whole concepts of things, but everything from my military friends, bioweapons, who maintains the convention, bad as it is, WHO. Bioweapons to no more pandemic surveillance, no support for Gavi, the vaccine alliance that brings vaccines to low-income countries. It's all going to go. It's already started to go. USAID, gone. So, international mental health and psychopharmacology organizations have to start thinking about how they're going to respond. going to have to create a strategic plan. And I would urge this organization and its leadership to start thinking about how to do that. And as I said, arrange a time to chat. I'm happy to talk to people who want to start doing this. In order to do that, we have to have key messages. You have to have key players. You have to have key vehicles for getting the message out. And you have to have specific resources to let you do that. Those 4 things are necessary. And you can't count on WHO anymore. You can't. It's not that they don't want to do this, but the backlash against WHO, pushed by Trump in Canada, pushed by, members of one of the political parties against the WHO, are horrific. And so the U.S., as you know, withdrawn from WHO. They've withdrawn their funding. And they are now aligning themselves diplomatically, geopolitically with Russia, Iran, North Korea. Nice company to keep. But this is going to have a huge impact on child and mental health in your countries and in countries all over the world. It's not going to happen tomorrow, but it's going to unravel. I was talking with friends and they said, because I had given a talk on the rise of autocratic kleptocracy and the demise of democracy. And they said, well, how is this going to happen? And I said, democracy is going to die slowly by step, slowly by step, and then all of a sudden. That's how it's going to happen. The impact on child and youth mental health globally will be a little bit, and a little bit, and a little bit, boom, tipping point, Malcolm Gladwell. That's how it's going to happen. So there is time. There's time. There's time for the organizations that are important, like this Organization for International Mental Health, to start putting together a strategy, start talking with other international mental health organizations. And those of you who come from a different country and are here, you can think about this and think about how your country can start getting ready to deal with this. So on my agenda is to talk to the Canadian Psychiatric Association, the Canadian Chairs of Psychiatry, the Canadian Child and Adolescent Psychiatrist Group, and the pediatric. We need them on board. And the Canadian Medical Association, the Royal College, all that blah, blah, blah stuff. Because there has to be an effective response. And there is time to prepare an effective response. We don't know how long the runway is. But we do know that we have a runway and we have to act while we still have an opportunity. So I don't want to close with a real negative feeling. And I want to share with you a positive feeling and a positive response by sharing with you as a Canadian what Mr. Trump has done to Canada that nobody else could have ever done. He called us the 51st state. And that brought Canadians together like I've never seen for decades. By the way, if those of you who are interested in geopolitics, there is a real, I'm deviating here, but it's sort of interesting. Military guys will love this. There is a reason why Trump has chosen Canada, Greenland, and Panama as his first 3 targets. The Hutus already damaged the shipping in the Red Sea, right? They're Iranian. He controls trade. The only place he can't control is in the South China Sea and the Strait of Macau. But if he can control Panama, Greenland, because it's the eastern entry to the Northwest Passage. Russia has the entry at the west, remember? And he controlled Panama, he controlled the entire circular trade route, right? That's why. But Canadians don't like to be called the 51st state. And we come together. And I've never seen Canadians who have been disparate ideologically, disparate economically, disparate politically, coming together and saying, we can't have this happen. And one of my very good friends is on the Prime Minister's Economic Council, and he tells me that he's never seen before in his life labor and business and academia coming together in a whole to create a unified strategy against the U.S. So that gives me a lot of hope. It also says that if the international mental health organizations can come together and create a strategy for how to deal with this emerging threat, then we're going to be okay. But if we avoid it, if we don't see it, or if we pretend it's not there, we're not going to be okay. So at the end of this, I've hoped that I've been able to share with you why political advocacy, political activity is important, some of the levers that you can learn to push, and to alert you to the fact that this is probably going to get worse before it gets better, and that we as child and adolescent psychiatrists or psychologists or people who are mental health professionals, we have a responsibility to our patients. We have a responsibility to the mental health of people globally. And so that means that if we want to discharge this responsibility, we have to see the threat, and we have to start preparing for how to deal with it. So thank you very, very much for your attention. I appreciate you coming here right after your lunch and not going to sleep. And we'll see you later on during the program. Thanks again.
All right. Excellent.